Okay, welcome back. Let's talk about the signs of pregnancy in women. So, what shows that someone is pregnant, or how do you know that you are pregnant? There are several signs that can be used, or signs that you can experience, and you realize that you are either pregnant or your partner is pregnant. The first sign can be maybe missed menstrual period. You miss to go into the menstruation period. Remember, this one is being done monthly among all women. So when you miss your menstruation period, there you start to predict that you can be pregnant. The second is excessive tenderness in her breast. So you feel some changes within your breasts that appear to be abnormal. So when you experience such changes, get to know that you might be pregnant. Fatigue. When you experience fatigue, there you realize that chances are there that you are. Change in appetite. You find that at first you used to be having the desire to eat, but now you feel like you are not interested in eating, you are not hungry all the time, and yet you haven't eaten any food. So if you experience such change, get to know that you might be pregnant. Morning thickness. You experience some thickness in the morning. Before waking up, you feel weak. You feel like you're thick in the morning. There, get to know that someone might have scored the penalty in you. Then, spotting or light or irregular menstruation flow, or you may experience some changes within your menstruation flow. There, get to know that you are or you might be pregnant. Then when you ask yourself, am I pregnant? So what can you do after experiencing such signs? The first thing you can do is to take a urine test. It's a quick, simple test that tests for the hormone HCG within the female's urine. So you go to a health doctor, or they test your urine. If they test for the hormone HCG within the female's urine, then HCG is released by a woman or women when the egg attaches to the lining of the uterus. So it's only realized when a female is pregnant, or early pregnancy test. It's an early pregnancy test. 2, you can go for the blood test. Maybe if at all you have not gone for the urine test, you can go for the blood test. This test also detects HCG, but you must go to a doctor and have blood drawn from you. So most people get the blood test after they tested positive for the urine test. So after you have tested using urine and you find out that you are pregnant and you are doubting whether it's true or not, so what you can do is you can go for the blood test to a doctor and they test your blood. Go to medical specialist, obstetrician doctor who specializes in care of pregnant women and the developing fetus. You go to this guy, obstetrician or a gynecologist who specializes in the care of the female reproductive system. Pregnancy term. Pregnancy is based on 40 weeks of development, 10 months in total. The first month we do not count it due to the fact of not knowing the exact day when you got pregnant. So broken down into 3 sections called trimesters. The uterus is a masseter organ that receives and supports the fertilized ovum during the pregnancy and contracts during childbirth to help with delivery. So, fertilization. Fertilization is the joining of an egg and a sperm. When these two come together, we call that fertilization. And where does it occur? It occurs within the fallopian tube. The ovum, also known as the egg cell for a woman. If fertilization occurs, the egg will become an embryo. A zygote is just a cell produced when a sperm fertilizes an egg, contains genetic material that forms the baby. So, blastocyst, a thin wood hole structure in embryonic development that contains a cluster of cells called the inner cell mass, from which the embryo arises, and the outer cells gives rise to the placenta and other supporting tissues needed for the fetal development within the uterus, while the inner cell mass gives rise to the tissue of the body. So an embryo is a developing baby through the second month of growth after conception. So the rapidly dividing mass of cells inside the woman's uterus. Okay. Fetus is a developing baby from the 9th week after conception until birth. So it turns to be a fetus from the 9th week after conception. Okay. Placenta supplies fetus with oxygen, supplies fetus with nutrients, passes out wastes from the fetus, and etc. That's the importance of the fetus. Then umbilical cord defines the umbilical. Then it's a lobe-like structure that connects the embryo to the placenta. Okay. Let's look at the insemination, the process when a sperm is injected into the female with a syringe. That is insemination, artificial insemination. And then in vitro insemination, procedure that involves removing a living egg from a female, inseminating the egg with the donor sperm, and returning the fertilized egg back to the woman. This is done when the partners are not having cells that can produce, so, or if the sperms are too weak to make a woman conceive. That's when they do that. Then why is prenatal care important to the mother and the baby? If a baby doesn't receive proper nutrition, it may cause premature birth. So prenatal care is very important. Females should not drink alcohol when pregnant. Okay. Females should not smoke or inhale smoke. Then diet and exercise are very important to the mother and the baby, because it increases the chances of a healthy baby, increases the chances of a proper birth weight for the baby, and many others. Types of tests for check of abnormalities for the fetus: you can go for the ultrasound scan. They test the sound waves to depict an image of the developing fetus. Okay. Harmony also tests for 2 other genetic conditions: trisomy 18 syndrome and trisomy. Types of tests to check for abnormalities of the fetus: we have amniocentesis test, chronic virus test, and many others. Thank you. Thank you for watching us. Thank you for attending today's presentation. As per now, let's have a break. We will continue from where we have stopped. So if you want to see more of this, go to our YouTube channel and subscribe. Click on the notification bell so that you don't miss any of our presentation, any of our videos. Thank you.